Because it was sterile, right?
No,
Yeah. I mean, it's sterile, so my argument is I'm keeping it sterile. That's the purpose of it. And I've done that a million times in practice to keep it sterile. But is it good practice?
no,
To leave this dangling around in the air like that?
absolutely not.
Okay, so you guys are all getting my point?
Yeah.
Right, that it's not a good practice? So that's what I meant when I said navel cap. You can't do that.
Never seen that before. That's why.
Good. That makes me happy. That's a better practice. Okay, so what other supplies do we need?
IV starter kit, saline.
Good. So what's in the IV starter kit?
And the chlorhexidine.
Okay, why do we use ChlorPrep?
Chlorprep.
To clean. Good. And we use that instead of alcohol. Okay, what else is in here that we need?
The tourniquet.
Yes.
Okay.
Yes. If they were allergic to ChlorPrep, it is acceptable to use alcohol.
Okay.
Okay. What else do we use?
The Tegaderm.
Tegaderm. Good. There's a Tegaderm in there. What else is in here?
The
Tape.
tourniquet.
Tape. Good. What else are we going to need? Gauze. Yeah. In case we miss, just so we're prepped, and to clean up our mess if we need to. Okay. What else do we need? That's it. Oh, we're gonna. Oh, thank you. Awesome. And look, a brand new flush. Excellent. Now, this is why this looks different, you guys. Is this would normally be in a sterile container. Okay. This is where I asked for you guys to do simulation. Would I normally take one that's been used before? No. So I'm just asking you guys to give me a bit of credit, or not credit, but this is in a package and this is all sterile. Would I typically take one that and reuse it? Never. Okay, thank you. Okay.
What is this one?
This is actually called different things. It could be called a saline lock. It could be called extension tubing if you've got one that was a lot longer. I call it a saline lock. The reason it's called a saline lock, sometimes I accidentally, if I'm tired, will call it a heparin lock. Because nowadays we flush with saline, but in the old days we used to flush with heparin. Yes. Oh, that's so funny that you get shocked. I hate flushing with saline still. Okay, so you guys agree this is what we need. Okay, what else do I need? So what am I going to do now? I need gloves, don't I? Because look at this. So can somebody grab me a size medium, please? Why do I need gloves?
Because is it a clean procedure?
Good.
It's a clean procedure, right?
Okay, it's mostly clean, but there's going to be certain parts that are going to be sterile. All right, so we've explained the procedure. First thing we're going to be doing is we're going to go through the veins, okay? And this came up as a question too. Well, where are we looking for veins? And can you guys help me with this? Where am I going to search for veins? Where do I start looking for veins? Why do we start at the hands?
So if you bust a vein, you can go up still.
Good. What are other discluders or whatever? I don't know what the word is. What facts can you play when you're looking for veins that maybe make you not able to use a site?
Oh, like if they had a mastectomy?
I heard it right there, mastectomy. They've had a mastectomy that negates the whole arm. Okay.
Something else. It was a mastectomy or fistula?
Good. Fistula?
Fistula.
Okay, if they've had a fistula, think of that. If there's a big shunt there, that whole arm's off limits.
Talked about it in class today or yesterday.
All off limits. Or kind of just think about if it's burned, if there's any kind of a lot of trauma. It's almost common sense kind of thing. You guys know I've talked to you about my mastectomy. This arm's all off limits. If I even so much as get a paper cut and went up here, my whole arm swells up. So it is legitimate why they tell you that.
And
I can
that's
understand.
for life, right? Mastectomy. If they had a mastectomy, but if they had a double mastectomy, what do you do?
Still, I've had a double mastectomy, but it's because of the lymph nodes. They took out 39 lymph nodes on this side.
Okay.
That's a huge dissection. So that's what
Are
causes
they
the problem.
able to use this one?
Totally.
Yeah.
But it's hard to find something on this arm because, of course, there's no veins anymore.
Because of the mastectomy?
Just because that's all you have left, they use it up so quick. So it gives you less of a chance.
So where do they get your blood?
I had a port for 10 years, which a lot of times breast cancer patients will have. So my port was here, but it actually just came out about a year ago. So
So where will they go now?
here, hopefully I stay healthy.
Or will they go on your leg,
You know,
forehead?
yeah, that's
Keep
it.
going.
That's kind of, and that's actually why I talk about this, you guys, because that's why sometimes you don't have a lot of choices. The one place I have an IV is right here that they can get it. That's my one spot that they can get it.
Okay.
Yeah, how's that?
I can feel it.
Mm-hmm. So that's kind of where I'm going with that you really don't have a lot of choices sometimes. Okay, so you figured out what size catheter are you going to use?
22.
Thank you. 20, remember, is kind of like your go-to, if you will. You're going to start at 20, but figure out, smaller is better. If you can get away with smaller, I love that you said a 22. Do you think I'd want you putting a 20 in my thumb right there? No. What about, there's a couple times when you have to go bigger. When are you going to have to go bigger?
Surgery?
Surgeries, yes. And what else?
Obesity?
Maybe. What I'm talking about is certain things that if you're giving.
Oh, like
I heard it. If you're giving blood, what size do you need? 18. If you're giving blood, you're going to need a size 18. Think about that. Blood, squeezing those blood cells, how are you going to get them through the catheters? Okay. So you need to go for bigger. So 18 for blood, lots of volume, 20. When you get to OB, it's going to be an 18. Okay? All right, so I'm going to use a 22 because it's just 100 mils per hour of normal saline. Easily 22. I'm using whoever supplies these. That's fine. 22. And you got all that. What's next, you guys, is let's get all our prepping, and we're going to figure out, let's figure out the vein first. How do you put the tourniquet on? You guys know?
Really tight.
I know, and I hate that. I hate tourniquets. We're going to palpate, and I've washed my hands before I feed them again. I don't need to have my gloves on yet, just because for me it's easier to be feeling like this. Okay? And here's a great one right here. It's going to be hard to get in.
Don't forget to pull your hair back.
I know, it's horrible, isn't it? Okay, I'm going to use this one. So I'm taking the tourniquet off while I do my prepping. Okay? How am I going to prep? Thank you guys. You're awesome at getting all these supplies. I'm going to clean. I'm really exaggerating this because MedSurg B, you guys are going to have central lines, and you're going to be noticing a lot of similarities between what we're doing right now. Notice I cleaned with alcohol. You're going to notice tomorrow I'm going to be getting you guys to do ChlorPrep, cleaning your area before you put your supplies down. So really you'll be like, we already know this. You guys, because you're so well prepped, aren't going to be struggling or going to have a hard time with it. And that makes me proud. Okay, next let's get the tape out. And I love my tape.
So unless you're going to instantly attach it to a daily pack or something, I always find it.
And there's another one. There's another one. I actually just used the whole thing. Why not? Done. Okay, and what other supplies do we need? We've got everything ready. Oh, I know what I haven't done yet. What haven't I done yet, you guys?
Primer.
We've got this ready, and this is a personal decision. If you wanted to go directly in, that's correct. But life, I find it much, much easier if you guys prime and use a saline lock, okay? But again, both are completely correct. Specialty units will go directly in, but if you do a saline lock...
Without using the saline lock?
What's that?
Without using
Yes, it is absolutely okay if you wanted to connect directly in like that. In fact, that's how Melinda used to teach it, because she's OB, right? And specialty units will do that. But if you connect directly in, think about that. When you change it to saline locks, you're going to have to break everything down. You're going to have to open up your site. It's kind of higher risk in a lot of ways. So that's why we really try and encourage you to do this. It doesn't mean you're wrong if you go direct. It just means there's a bit of a higher risk. Okay, so I love that you guys have already gotten all the supplies here. So I've opened this up. I've taken it out of its package. So where am I not going to touch? Right, in here. In real life, this would not probably, it might not have this on there. I can't remember if they come with it or not. This is what I'll always be checking you for to make sure you do. Because This is what I'll sometimes see people forget to do. So here's the hint I'm giving you. First of all, I'm going to be watching to make sure you connect this, and I'm going to be watching to make sure that you prime it. Why is this so important?
Air.
Okay, air. Okay, make sure you do this ahead of time. Now, after you've done this, what I tend to like to do is put this back in the package if you had it. Does that make sense? But because we don't have a package, I ask for a favor. Oh, thank you! And it can just go in that package. Does that make sense? And that's just, again, I appreciate you guys being flexible with that. It's just supplies. We go, I think last week or the week before, we went through about 150 of these. I think about $5 each. I'm learning all about cost now that I'm doing the ordering. Okay, so now what's next, you guys? You guys tell me, what should I be doing next?
Clean.
Clean, okay. And what am I going to clean with?
ChloraPrep.
ChloraPrep, okay. Break it, squeeze it, and now we're going to clean. Brisk motion. Again, you're going to notice I talk about this tomorrow with central lines, okay. Start in the center, work your way out, and clean it. I'm doing it a bit really hard because I want to clean this arm because it's really bugging me. But okay, it's clean. What aren't I going to do now?
Fan up.
Any of that kind of stuff. All right. Waiting for it to dry. And I'm gonna. You guys have done all the work already. And let's get our supplies ready. I'm going to open this up. Okay. And now, would you guys agree that we're ready?
Mm-hmm.
Okay, and I apologize, your assistant, whoever you're working with, should be doing this part for you. Make sure one of these is up high, make sure it's open. In real life, obviously, you would not have to do that. Go ahead and reapply the tourniquet, okay? Reapply the tourniquet. In real life, of course, you would be asking your patient, make a fist if you need to do that. Make sure you've gotten it, and you know where you want to go. Okay, so now this is the part where people start getting nervous, and this is the part where I'll be watching you. I'll try and put it up here so you guys can see. Okay, we've already figured out where we're going to go, okay? But this is where you guys, anchoring helps. I don't know how I'm going to do that. I'm left-handed, so it makes it a bit awkward. We're going to open it up, okay? Bevel up, okay? And again, what you want to be doing is we want to anchor that vein down.
What do you mean bevel up?
Bevel up. See how there's that hole right there?
Uh-huh. Oh, that's how I do it. I thought that you meant the pointy part up. Okay.
Yeah, see how there's that? And if I turn it that way, see where the hole is? You want to be able to see the hole.
Uh-huh, okay.
Okay. Or another easy way to remember, see that where that button is? Mm-hmm. The button up.
So the pointy.
Mm-hmm. Almost just, it makes it easier to slice, if you will. Okay, so this is kind of where, and I'm going to go slow with this. This is where these mannequins, and I apologize for this, this is where it's not like it is in real life, okay? And this is where I'm noticing, and Elisa will tell you this in OB, she's noticing a difference with our students. Because right now, look how tough this is right here. So you're going to have to use a bit more force to get that in, pressure, than you will in real life, okay? So watch how I'm doing this. Watch the angle I'm at. In real life, about a 25-degree angle. Everybody seen that? Okay. And what I'm going to do, notice how I'm anchoring it really well, and I'm going to insert. Everybody notice that I inserted that. Mm-hmm. And how long am I doing it? Until I see the flash. Everybody saw that I saw the flash. Now what happens? I've seen that flash, and watch slowly. I'm keeping this steady, and what am I going to do? I am now going to advance the catheter, okay? Watch how I'm slowly advancing that catheter. Now, notice how I'm using two hands. That's absolutely okay to use two hands. What's important is I'm not wiggling this around, okay? Keep it as steady as you can. If you want to be fancy, you could try and do it with one hand, but that's tough. I'm not coordinated enough. So it's absolutely fine to use two hands. And I'm going to advance it, and I'm ready to come out. You guys see?
So is it okay to touch this little part?
Yes.
Because then
Yes.
I've seen that they push from here.
This part right here, what's your safe zone for touching? Your safe zone for touching is right here. See this blue part right here? Absolutely. This is your safe zone for touching. Okay? What's not supposed to, and some instructors are really picky about this, you're not supposed to touch in here. Okay? That's what I'm looking for. Okay? But what am I going to do now? I'm getting ready to now switch out. So why am I putting my hand right here?
Stop the bleeding.
To stop the bleeding. But to make it easier, I'm just going to go like this. Okay? So by pressing down like that, that will stop the bleeding from coming out. Does everybody understand that?
How far up can you...
Okay, that's a really good question. I want you guys to think about that catheter that I just advanced. How long was that catheter? And if you're not sure how long it was, it's going to say right there how long it is. It's a 1-inch catheter that I've just advanced. So I don't want to occlude it right here, do I? I want to do it up here, because if I occlude it right there, what am I going to do? I'm going to bend that catheter. So do it right up about here.
Like 2 or 3 inches up?
Yes, definitely. Okay? And the nice thing is, if you occlude it like that, you've got lots of time. You know, I could be sitting here and cleaning and all that kind of stuff, and it's not going to be bleeding everywhere. Okay? Does that make sense to everybody?
Mm-hmm.
Okay, so because I'm including it, I've actually clamped there, but your partner can do that. Okay, so what's the next step going to be? And I'm getting ready to do
Take
this.
the tourniquet off? Or
Yes, very good. A lot of times people forget this. Tourniquet comes off, and I'm now ready to do this. Okay, and notice how I can do this. I'm going to loosen this off. Okay, so it's ready to attach, and I'm going to press the button. Notice I'm holding this with my 2 fingers, and I'm going to hook it up. Everybody see that? Okay, now you guys, and this is something I quite often will see people don't do too. It needs to be flushed. Make sure, and look at how I'm holding it steady with one hand. Go ahead and flush. You guys you've done a great job priming that, so make sure you flush it a little bit. And some places will actually have wanted you to do what's called an aspiration. See how I just pulled back and I got blood? That's pretty good, isn't it? Mm-hmm. That's absolutely correct to do too. And I'm flushing it. And it's okay if you flush a little bit in these arms just to get the feel for it. Okay, would you guys agree I flushed? Mm-hmm. Mm-hmm. All right. So I'm going to actually disconnect that now just to make it easier. Whether you disconnect or leave it hooked up, both are correct. All right? Because we're going to be starting that at 100 mils per hour, so it doesn't really matter. Okay, so what's next, you guys? Who remembers?
This thing, right?
Yep. But do I want to put it on right away?
No.
What do I need? I need to clean. Why do I want to clean? Get rid of all that blood. Okay, think about that. Bacteria loves to munch on old blood, so make sure it's clean. That's something else we watch for. So I'm giving you all these hints. I don't want you to think I'm nasty, but... And that's where your gauze can come in handy as well. In the old days, you guys, we used to be allowed to use these gauzes to like help position, like stick them under there and stuff. But you're not allowed to do that anymore. Now, the only thing you can use these gauze for is to help clean. Okay, we're now ready. Would you guys agree they're ready to tape down?
Mm-hmm.
So what's the first thing I'm going to use?
Tape it in.
Right. So this is something, again, we'll be watching for. This first piece comes off like this. And you'll see that little piece right there in the top. Where is that going to go?
With the blue?
Yes, right up to the tip of the blue. Right. And I did touch that, you guys. That part I did touch, but that's still okay. There. Now when sealing that down, I'm going to start in the middle here and work my way out. And I think that's kind of where maybe you're confused. See, I had to touch there to hold it. Does that make sense? But there's no way you can get away with not touching that blue part, because you have to touch it to screw that together. Does that make sense?
Is that little hub on top, that little notch?
Is it under the notch or over the notch?
It's under. You can go right up. Oh, I see where you're going with that. Right up to there, but not over top of the notch. And the reason for that is it's fine right now. It's better because you have a saline lock, but the rationale is, what if you had to change this out? And if you had to change it out, you could do it without lifting up the sight. Does that make sense to everybody? So that's kind of why they say go right up to here, but don't cover that. Okay, so I've gotten rid of all the stuff. Now I'm going to pull this all up. Okay, but because I've only gone up there, it looks pretty loose still, doesn't it?
I would still tape
So what do you guys think I should do next?
it.
Good. Of course I stood up against it. A better place for these would have been if I pulled up the side rail and used that, or maybe perhaps if I'd used alcohol and put my tape right here. Those would have all been good places to use too. Okay, so this one's going to go underneath, okay, and then it's going to wrap over this way and then over the other way to hold it in place. Did everybody catch that? In the old days, again, we used to be allowed to do that underneath the tegaderm, but we're not allowed to do it underneath the tegaderm anymore. Okay, so when I did that, how come I couldn't make those go down here? What must be important when I put this?
You got to be able to assess it.
Good. You must be able, I want to be able to still see that site. So notice when I put these, they still went straight out like that. Okay, everybody see that? All right, we still have more tape. So the next piece that I like to use for taping down is straight across like this. Okay? And again, now look how solid that is. Notice when I'm playing with this, it's not moving there at all. Think about that. Movement will cause irritation. What haven't I done yet? It needs to be taped, and this also needs to be clamped. That's another thing we'll be watching for. Why can't I leave this open?
Infection or something can get in?
Yeah, and just kind of like back up, exactly. Next one you guys want to do is we want to go across like this. Oh, I made it too short. And one more piece, you guys, but this one's better if it's tented. And tenting means if you can get the tape underneath it and kind of hold it up. Why do you guys think I want this one kind of held up a bit more? Right, because if I press it down, look what's going to happen at the site. That make sense to everybody?
Both of them are tent, right?
Yes, they both should have. So I actually did a terrible job on that, and I'm going to actually take it up because I did a horrible demo job on that. Normally you'd get a brand new piece. And that's going to go like that. Okay. All right, and now information. What information are you going to put on that?
Name, date, time, initials.
Yep, date, time, and gauge. Some people even will want you to say how long the catheter is, meaning I just put it in a 1 inch. And if you're wondering how long it is, it says it right there. Okay, but as long as you get the catheter, I'm fine with that. Okay, and where are you going to put that information? There you go. Okay, did that help you guys?
So date, time, and the
Initials.
Yeah, initials, and then the size.
Size of the catheter, number 22.
But don't we need for him too? I'm not confused. Do we for him? For the patient?
The name.
Oh, that's labs. Okay, if you're ever
Oh,
drawing
that's
labs,
labs.
remember, whenever you're drawing labs, you'll always need to get 3 from the patient and 3 from you. Yes, so the 3 from the patient, if you're sending it somewhere, would be
MRN.
patient's eye. What would the 3 from the patient you always get?
MRN.
MRN?
The birth date
Mm-hmm.
and the patient's name, right?
Right, because that's if you're sending something off. Like, let's say you had to do blood draws. So let's say, and you guys are allowed to do that, you had to draw blood before we put this in. If we had to label those, you would have to get that information. Okay, but I've just put a saline lock on, but the order's for 100 mils of normal saline per hour. So what do? This is why I love using a saline lock. Make sure this is clean. How are we going to clean that?
20 seconds.
At least 20 seconds.
If you put one of those caps, you wouldn't have to.
Exactly. As long as the cap had been there for at least 3 minutes. I actually like to say 5 minutes to be safe. Okay. Make sure it's clean. And we're going to hook it up right there. I'm not going to go through the pump. You don't have to do the pump for the competency. But I will check. One more thing it should be done is tape this piece down. And you'll make sure that this is open. I'm not going to do it right now. And you're finished.
Do we have to label the bag?
What's that? You know, some places do. I'm not going to, I would just want you checking to make sure that it's normal saline. So.
So we are gonna hook it up for this.
Yeah, because your order is going to be normal saline at 100 miles per hour.
Okay.
And you check that before you hook it up.
Yep. Absolutely.
But you said we're not gonna make them do the pump, right?
I don't think.
We didn't do it last time.
Yeah, I don't think so because you guys won't get. You'll get the pump when you do the secondary med lab, and then you'll be doing the pump. Okay. Did that help you guys?
Yeah.
Okay. There you go. So it's all yours to practice.